Imagine this. You've got this valuable mare, maybe the cornerstone of your breeding program, but
Hmm.
she's not getting pregnant.
Yeah, it happens.
Or maybe she does conceive, but then, heartbreakingly, she loses the foal. Early on, maybe even late term.
Mm-hmm. It's incredibly tough.
It's so frustrating, isn't it? And, costly, too, emotionally, financially.
Yeah.
You're looking for answers, a path forward. What do you actually do?
Right. Where do you turn?
Well, today we're doing a deep dive into exactly that. We're looking at a really key diagnostic tool in equine reproduction, the equine endometrial biopsy.
A critical piece of the puzzle for sure.
Our mission here is really to unpack it. What is this thing? Why is it so important? How's it done? And maybe most importantly, what do the results actually tell you about your mare's uterine health?
And her chances, of carrying that fall all the way to term.
Exactly. It's kind of a shortcut to getting really informed about fertility.
And to guide us, we've pulled together insights from a really comprehensive diagnostic and prognostic guide, and also an evaluation and management overview, sort of the key literature on this.
Great. So let's get into it. Let's unpack this diagnostic journey. First off, what exactly is an equine endometrial biopsy? What are we talking about?
Okay, so at its simplest, it's taking a tiny, tiny tissue sample
From where specifically?
from the lining of the uterus, the endometrium, and that sample goes off for a really detailed look under a microscope.
Okay. And why? What's the main goal?
Well, its primary purpose really is to check for two main things: inflammation and fibrotic changes.
Fibrotic changes.
That's scarring, right?
Exactly. Scarring within the endometrium. And these two things, inflammation and scarring, they're, very common reasons why mares struggle with infertility.
Gotcha. So when would a vet actually say, okay, I think we need to do a biopsy on your mare? What are the triggers?
Yeah, that's a key question for owners. There are several situations. First, obviously, are those mares that repeatedly fail to conceive, the infertile or subfertile ones.
Right. Then you've got the mares with that sad history of losing pregnancies.
Early embryonic death or even late-term abortions.
Especially if it keeps happening. Also, if your mare has ongoing issues with uterine fluid or, chronic endometritis, that inflammation we mentioned.
So the biopsy helps figure out how bad it is.
Exactly. It gauges severity and really helps guide the treatment plan.
Does the mare's age factor in?
Oh, definitely. Older mares, say late teens, 20s, they often develop age-related changes, degeneration in the endometrium, so a biopsy is often recommended there.
Makes sense. What about before you even buy a mare?
Good point. For potentially valuable broodmare prospects, it's often part of a pre-purchase exam. Helps assess their future fertility potential.
Okay. Any physical signs in the mare herself?
Yeah, mares with what we call poor perineal conformation, like pneumovagina or windsucking.
Where they draw air in.
Right. That predisposes them to uterine contamination and infection, so a biopsy can be useful. Also, if a mare has known endometrial cysts, the biopsy helps evaluate the tissue around the cysts.
And after foaling. Any situations there?
Yes, absolutely. If a mare has had complications post-foaling, like a retained placenta or a really bad uterine infection, metritis, a biopsy can assess how well the uterus has recovered before you try to rebreed her.
So understanding these reasons helps you, the owner, know when to even ask your vet about this option, right?
Precisely. It empowers you to be part of that diagnostic conversation.
Okay, so we know why we might need one. Now let's get practical. The how. How is this little tissue sample actually collected? It sounds delicate.
It is, and it's typically done by a veterinarian, often right there at the farm in a field setting. Timing is really, really important here.
Okay, timing. What's the ideal time?
Ideally, you want to do it when the mare is in estrus or heat.
Why that?
Because her cervix is naturally relaxed and open, it just makes getting the instrument through much easier and safer. Plus, the endometrial glands are more active then, which, believe it or not, helps with the diagnosis under the microscope.
Can it be done at other times?
It can be done during diestrus, the period between heats, but it's more challenging. The cervix is tightly closed, so it requires more careful manipulation. Sometimes a vet might even need to use a mild muscle relaxant.
Got it. So, assuming the timing is right, walk us through the steps. What does the vet actually do?
Okay, first, preparation is key. Thorough cleaning and disinfection of the mare's perineal area. The vet wears a sterile OB sleeve, of course.
Standard procedure.
Right. Then they use a specialized instrument. It's long, slender, called endometrial biopsy forceps. It has this little cup-like jaw at the end.
Okay.
This instrument is passed very carefully through the cervix into the uterus. Now, the vet uses their other hand rectally to guide the tip of those forceps to the specific spot they want to sample.
Where do they usually aim for?
Often the base of one of the uterine horns, near where the oviduct joins the uterotubal junction.
Why there?
Well, that's often where the embryo first fixes or attaches, and it's also an area where significant changes, like scarring, are frequently found. Sometimes, though, they'll take samples from a couple of different locations just to get a broader picture.
And they just snip a piece. How big is the sample?
It's really small, usually about 5 to 10 millimeters long, maybe 1 to 3 millimeters across. Tiny.
Okay. And then what happens to that little piece?
Immediately, it goes into a sterile labeled container filled with a preservative solution, typically 10% neutral buffered formalin.
And that preservation is important.
Absolutely crucial. Proper fixation is essential for the pathologist to be able to accurately examine the tissue structure later on. Then it's sent off to the lab.
Right. So the sample's off to the lab. What about the mare? What happens for her right after the procedure? Is there any special care needed?
Generally, it's minimally invasive. Some vets might give a single dose of an NSAID like Banamine or phenylbutazone just to reduce any minor discomfort.
Yeah.
And if the biopsy was done during distress, when she wasn't in heat, the vet might give a shot of PGF2.
The hormone to bring her back into heat.
Exactly, to delyse the corpus luteum, unless she's potentially going to be bred on that cycle. But it's really critical to remember if there's any chance the mare is pregnant, you absolutely do not do a biopsy. It's contraindicated.
Big no-no. Okay.
Yeah.
Assuming she's not pregnant, when can she be bred again?
Usually breeding can resume on her very next estrus cycle without any issue.
All right. Now, this is where it gets really interesting, I think. The results come back from the lab. Let's talk about the Kenny-Dewey classification system. This sounds like the key to understanding what the biopsy means.
It absolutely is. This system, developed by Drs. Kenny and Doig, is the standard way pathologists report endometrial biopsy findings. And it's not just describing what they see.
It's predictive.
It's prognostic. That's the real power. It grades the mare's uterus based on the tissue changes and gives you a percentage, a real statistical likelihood of her ability to conceive and, importantly, carry a foal to term.
Wow. So it's like getting odds on her fertility. What specific things are they looking at in that tissue sample to assign a grade?
They evaluate several key features. First, as we mentioned, inflammation or endometritis. They look for inflammatory cells, what type, how many, where they are, is it scattered or widespread? Is there evidence of active infection like bacteria or fungus?
Okay, inflammation. What else?
Second, fibrosis. That periglandular fibrosis, the scarring around the endometrial glands, this is a huge factor.
Why is scarring so bad?
Because it messes with the gland's ability to function properly. They produce something called histotroph.
Like uterine milk.
Kind of, yeah. It's essential early nutrition for the embryo. Scarring interferes with that and with blood supply. It's often age-related, and, importantly, it's generally considered an irreversible degenerative change. They assess how severe it is, how widespread.
Irreversible. You know, it's a key point. What else is on the checklist?
They look at the overall glandular health, the density of glands, their shape, are they active, are they dilated or cystic? Then, lymphatic lacunae, or cysts. These are dilated lymphatic vessels.
Like fluid channels.
Sort of. If they get really big or widespread lymphangiotasia, they can physically block the embryo from moving around properly or interfere with the placenta forming correctly.
Can you tell that from the outside?
Sometimes, if it's really severe and widespread, the uterus might actually feel kind of jelly-like on rectal palpation. It significantly lowers foaling rates.
Yikes. Anything else?
Lastly, they assess vascular changes, or angiosis. These are changes like hardening in the uterine blood vessels, often related to age and how many falls the mare has had, her parity.
And that affects blood flow.
Exactly. Reduced perfusion, which isn't great for maintaining a pregnancy.
Okay, that's a comprehensive checklist.
Yeah.
So based on all that, the pathologist assigns one of the 4 Kenny-Dewey categories. Let's break them down, best to worst. Category 1.
Category I is the best news you can get. It means the endometrium is essentially normal, or maybe just has some very minimal scattered inflammatory cells, virtually no scarring.
Yeah, the prognosis.
Excellent. An 80 to 90% chance of conceiving and carrying that foal to term.
Fantastic. So for a Category I mare, management is just
Business.
business as usual.
Pretty much. Focus on good routine breeding management, timing, hygiene, the basics.
Okay. Moving down the scale, Category IIA, what does that look like?
In IA, you start seeing some definite but milder changes, maybe mild to moderate inflammation spread throughout or mild to moderate diffuse scarring around the glands, maybe a few little nests of scar tissue. Crucially, there's no active infection.
And the chances for IIA? Still pretty good.
Still good, yes. The prognosis is about 50 to 80% chance of carrying to term.
That's a wider range.
It is, and that's because these mares often need specific treatment to address that inflammation or maybe support the uterine environment. The good news here is that category IA can often be improved with the right management.
Okay, so there's potential for improvement. Now, category IIB. This sounds like it's getting more serious.
It is. IIB means more significant changes. We're talking moderate to severe diffuse inflammation, often with signs of active infection, or moderate to severe widespread scarring, more layers of scar tissue around the glands, more fibrotic nests. You might also see glands starting to shrink or become cystic.
What about those lymphatic cysts?
Right. Widespread lymphangiectasia on its own can actually put a mare into IIB, even without severe scarring or inflammation, because it impacts function so much.
And the prognosis for IIB?
It becomes much more guarded, only a 10 to 50% chance of carrying to term. It's a big drop.
Wow. And management?
Requires aggressive, often prolonged treatment. And remember, the fibrosis, the scarring component in IIB, is often irreversible. It's also important to note if an IIB mare also has that widespread lymphangiectasia we mentioned, her category effectively gets downgraded to a third because the prognosis worsens further.
So IIB is a tough category. Might improve a bit with treatment, but guarded. Which brings us to category 3.
Category 3 is the most severe. You have severe, widespread, chronic inflammation coupled with extensive scarring, multiple layers of connective tissue around most glands, lots of fibrotic nests.
What else?
Marked glandular atrophy, lots of cystic changes, often active infections still present. And if there's severe lymphangiectasia, that's where you might get that palpable jelly-like feel.
And the prognosis? I'm guessing it's not good.
Very poor. Less than 10% chance of conceiving and carrying a foal to term naturally.
Less than 10%. Wow.
Mares in this category are often functionally considered barren for natural breeding purposes. The damage, especially the extensive fibrosis, is largely irreversible.
It's incredible how specific that is, going from 80–90% down to less than 10%. Are there any other small details the pathologist might mention that give clues?
Absolutely. It's fascinating, actually. For example, if they see cells called cytoraceas,
What are those?
they're basically cells that have mopped up old blood. Their presence tells you the mare has likely had a foaling, an abortion, or some kind of uterine bleeding within the last, say, 2 to 3 years.
Like a little historical marker.
Exactly. Or finding eosinophils, a specific type of inflammatory cell, can point towards pneumovagina, wind-sucking, or maybe urine pooling in the vagina, urovagina. Sometimes, though less commonly, it might suggest a fungal issue. It all adds detail to the clinical picture.
So we have these categories, IIA, IIB3, and the prognosis that goes with each. Now what? How does this directly translate into managing the mare? What are the next steps for you and your vet?
Right, the now what? The management strategy really flows directly from that biopsy grade.
Okay, let's start easy. Category 1.
Category 1, prognosis is excellent, so you just continue with good, solid, routine breeding management. Focus on timing insemination correctly, minimizing any contamination during breeding. Keep doing what you're doing, basically.
Makes sense. Now, category the IA, the ones with mild to moderate changes, but potential for improvement. What does treatment look like there?
These are really prime candidates for therapy. If the main issue is endometritis, that inflammation, then treatment is usually pretty aggressive. It often involves extensive uterine lavage, flushing the uterus with sterile saline, followed by intrauterine antibiotics.
Specific ones.
Ideally, yes, based on a culture and sensitivity test done beforehand to know exactly what bacteria you're fighting and what drugs work. If that's not available, broad-spectrum antibiotics like penicillin, gentamicin, or ticarcillin are often used for, say, 3 to 5 days.
Anything else for inflammation?
Yes, using oxytocin after breeding or after the lavage is really important. It helps the uterus contract and clear out any remaining fluid or debris. For tricky cases of inflammation, sometimes vets might infuse the mare's own plasma or serum into the uterus.
What about other issues found in IAA, like cysts or conformation problems?
Good point. If there are large or numerous endometrial cysts interfering, sometimes they can be removed or ablated using an endoscope passed into the uterus.
Like laser surgery?
Sometimes laser, sometimes electrocautery, yeah. And if the underlying issue is poor perineal conformation, like that wind sucking,
The Kanzlik's procedure.
exactly, a Kaslick's vulvoplasty is often crucial to prevent recontamination. And if the issue involves those lymphatic problems, edema management might involve drugs like cloprostenol, a PGF2 analog, sometimes combined with progesterone and estrogen therapy.
So for IIA, there are definite treatment paths, and the prognosis is generally good to fair if you address the issues.
Correct. You can often make a real difference for these males.
Okay, category IIB. More severe changes, guarded prognosis. Does treatment just get ramped up?
Pretty much. It requires really intensive and persistent effort. The endometritis treatment is similar to IIA lavages, antibiotics, but often needs longer courses, repeat treatments. Vets might also use adjunct therapies, things like intrauterine DMSO, maybe dilute iodine solutions, or chelating agents to help break down biofilm.
What if those standard treatments just aren't cutting it for a IIB mare?
That's when you seriously consider advanced reproductive techniques. Embryo transfer becomes a really key option here.
How does that help?
Because you collect the embryo from the IIB donor mare whose uterus is compromised, and you transfer it into a healthy recipient mare with a normal uterus. You're essentially bypassing the problem uterus entirely.
So the donor mare just needs to produce the embryo.
Right. It significantly increases the chance of getting a live foal from that valuable IIB mare's genetics. Another technique sometimes used is deep horn insemination, placing the semen much closer to the oviduct, hoping to improve fertilization chances.
But the overall prognosis for IIB remains guarded, even with all this.
Yes, because those underlying irreversible changes, the fibrosis, the vascular issues, they're still there. Treatment aims to manage the treatable parts, like inflammation, and maybe use technology to bypass the untreatable parts.
Which leads us to category 3. Less than 10% chance naturally. What are the realistic options here?
For category 3 mares, honestly, attempting natural breeding is generally not recommended. The chances of success are just too low, and it can be costly and stressful to keep trying.
So is embryo transfer the main path?
It's often the only viable path for getting offspring from a category 3 mare, provided she can still ovulate and produce a healthy embryo to be transferred.
So even with severe uterine damage, she might still produce viable eggs?
Sometimes, yes. The ovaries might still be functional even if the uterus is severely compromised. But if even ET isn't feasible or desired, then, reproductive retirement is often the kindest and most practical decision.
That's a tough reality, but the biopsy gives you that clarity.
Yeah.
You mentioned medications earlier. Any important cautions?
Yes, a couple of critical ones. You should never give progesterone supplementation to a mare if she has an active uterine infection, like endometritis.
Why not?
Progesterone suppresses the uterine immune response, so it will actually make the infection worse. Also, those drugs used to bring mares into heat, like PGF2 or cloprostenol, are absolutely contraindicated during pregnancy as they can cause abortion.
Good safety points. Now, we've focused heavily on the biopsy and the Kenny-Duig score. But you mentioned it's part of a bigger picture, right?
Absolutely crucial point. While the Kenny-Duig system is incredibly informative and prognostic, it's not the only piece of the puzzle. You have to interpret the biopsy results in the context of everything else you know about the mare.
Like what specifically?
Her complete reproductive history, how many foals, any past problems, the specific breeding management she's under, and other diagnostic findings.
What other diagnostics often go hand in hand with a biopsy?
Things like ultrasound exams, which can show fluid in the uterus, uterine edema patterns, or those lymphatic cysts we talked about. Cultures and cytology smears, looking for bacteria and inflammatory cells ideally, these are done before the biopsy to avoid contaminating the biopsy sample itself. Maybe even hysteroscopy, using a camera to look inside the uterus for things like adhesions, cysts, or foreign bodies.
So the biopsy is one tool in the toolbox, albeit a very powerful one.
Exactly. It's part of a complete breeding soundness examination, not a standalone diagnosis. You need the whole picture.
And thinking about that whole picture, what are some of the underlying risk factors that might lead to these uterine changes in the first place?
Well, we touched on some. Age is a big one. Parity, the number of foals a mare has carried, can contribute over time. Those physical anatomic abnormalities we mentioned, like poor vulvar seal causing chronic contamination.
When sucking again?
Right, or urine pooling. And just repeated episodes of inflammation, whether from breeding itself, contamination, or infectious endometritis, can take a toll over time and lead to scarring.
Is the uterine condition static, or can it change?
It's dynamic to an extent. Active inflammation, the endometritis part, can definitely change. Hopefully it improves with treatment. But that fibrosis, the scarring, that's generally considered a permanent and often progressive change. It tends to accumulate over time.
So treatment might clear up infection, but it won't remove old scars.
Precisely. That's why the prognosis for categories IA, B, and third, where fibrosis is significant, remains guarded or poor, because that damage is lasting.
Can you rebiopsy a mare later to see if treatment worked?
Yes, sometimes a vet will recommend a repeat biopsy, maybe about 2 weeks or so after finishing a course of treatment, to assess the response, particularly regarding inflammation.
Are there any risks with the biopsy procedure itself? You said minimally invasive, but any complications?
Complications are rare, but possible. Like any procedure involving instrumentation in the uterus, there's a very small risk of uterine perforation or causing excessive hemorrhage. But experienced vets take precautions to minimize these risks. And again, the biggest risk is performing it on a pregnant mare, which must be avoided.
Okay, so wrapping this all up. For you, the listener, dealing with mare infertility, what's the big takeaway message about endometrial biopsy?
I think the main message is that it's an incredibly valuable diagnostic tool. It moves beyond just guessing.
Right. It gives you objective information.
Exactly. It helps you understand the actual health status of your mare's uterus. It guides very specific management and treatment decisions. And maybe most importantly, it helps set realistic expectations for her breeding future.
It really is a fantastic example of how deep scientific understanding, looking at tissue under a microscope, translates directly into practical, impactful solutions in animal care, isn't it?
It truly is. When you think about the bigger picture, it just highlights the specificity and the prognostic power we now have with modern veterinary diagnostics. We can tailor our approach so much better now.
We're not just treating symptoms, we're understanding the underlying pathology.
Precisely. Even for something as complex and, frankly, often frustrating as infertility.
So maybe final thought for everyone listening. In breeding, so much feels like it's left to chance sometimes. Think about how transformative it is to have a tool like this, a biopsy, that can give you such a clear percentage-based prognosis for something as fundamental as continuing a bloodline or achieving that hoped-for foal. It really represents leveraging science, doesn't it?
Yeah.
Using that knowledge to give these incredible animals, these mares, the very best chance we can at successful reproduction and a healthy life.